You're watching an RH Reality Check production brought to you by rhrealitycheck.org.
Hi, I'm Destiny Lopez. I'm the Executive Director of Access Women's Health Rights Coalition based in Oakland, California. Each year since 1993, we've connected thousands of California women to reproductive health information and services.
So the name of the places that
But about 60% of the women we work with are seeking or considering abortion care, and we help those women with practical support through a network of volunteers who provide rides and housing and other kinds of transportation to women seeking abortion care. And when volunteer resources aren't available, we provide financial assistance through our Women in Need Fund to women who need that kind of care. And what we found in our work is that women from the most northern parts of the state, so thinking about up here in Redding and in Chico, really have the most persistent problems in accessing care. And so that woman would have to travel, let's say she's up in Redding, from here all the way down to the Bay Area to find her closest abortion provider. So that means women from the northernmost parts of California have to think about how they're going to get down to the Bay Area to get that care. Oftentimes, if it's after 20 weeks, it's a 2-day procedure, so they're going to need to take time off work, find someone to take care of their kids. They're going to need a place to stay when they get here. And so what we're finding is low-income women, women of color, young women, even here in pro-choice California, where arguably we have some of the most progressive reproductive rights in the country, still face significant and persistent barriers to abortion care. And if that's what's happening here in pro-choice progressive California, I can only imagine what it's like in states that don't have nearly the kind of laws that we have that protect women and protect their access to safety.
We actually gotten calls from families, actually. We got a call once from a woman, an older woman and her daughter, a 16-year-old daughter, who were trying to, they just found out that the daughter was pregnant, the 16-year-old, and she had come to her mother about the pregnancy and about, the fact that she didn't know what to do, and she didn't think that she could be a parent, and was trying to, they were both trying to figure out what they wanted to do.
The average age of our callers is 26 years old. Oftentimes women have families, are making decisions around what's best for them and their existing families. Women who are calling about abortion on average are around 21 years old, so a little bit younger, but again, still dealing with families and partners and relationships and making decisions based on all of the factors of their lives. So we have women who face bias or judgment when they go and walk into their local Medicaid office to access care. We have women who are using rent and food money to pay for access to services like abortion care.
There's a space in there to ask the question about referrals to abortion providers. I think the majority of
a lot of the women we work with were born after Roe v. Wade, so they don't know what a world looks like where women had to go to the back alley, where women had to get secret abortions or do other things physically to themselves to get abortion procedures done. And I think our fear is, and what we already know is, that if you have the wrong administration in the White House, that ultimately that's going to impact women. If someone's able to appoint a couple of Supreme Court justices, that really means the difference between a woman and her doctor deciding when she can have an abortion procedure and having the government actually tell a woman and her doctor when she's going to be able to have that procedure. And to me, it really speaks to why it's so important that we have progressive state legislatures, that we have progressive administrations in Washington, D.C., so that we protect these rights and not actually take away rights, but expand access to care. We have women here, poor women and young women and immigrant women can access our state Medicaid program, whereas in 37 states throughout this country they can't. But what they all have in common is they've experienced some barrier to information or barrier to actually accessing the services they need. It's meaningless when you can't access that care, and so that's why we do the work that we do every day, is we connect women to services.